Hello, my name is Jay Vanston, and the assignment today is a discussion of medical education, patterns, and expertise in the technology age. These slides were presented or were developed with the support of Doctors Catherine Behling, Angela DeSai, and Jennifer Fisher. The purpose of this presentation is to give the general outline of the role of simulation in medical education today, and then to conclude with a specific example of how simulation can be used in the realm of virtual microscopy. As an introduction, although simulation as a medical education tool has been present for years, technological advances have allowed them to play a much more prominent role in medical education today. In addition, as we've come to learn, the care of patients requires a collaboration of multiple team members, and so we're beginning to use simulation as well to enhance team communication and training. In regard to simulation in medical education, the first rule of medical care is to do no harm. And as a result, simulation can provide a great value in this area because it can allow individuals to work and learn high-risk procedures without bringing harm to the patient. Simulation is also used to learn new skills and procedures or to enhance existing skills. The broader use in the current era of medical education is to increase standards in patient care, education, skills, evaluation, and patient autonomy. There is a wide range of how simulation can appear in medical education. Some examples are the standardized patient, which often emphasizes such things as communication skills as well as physical diagnosis. One can use screen-based computer training to educate and simulate clinical situations. In addition, we often see, and in the early forms of simulation, there was partial task simulators. For example, learning how to provide intubation or CPR training, and many will remember the use of Resusci-Annie for basic cardiac life support. Today, there's even high-tech fidelity mannequin simulators which can provide a range of simulated physiologic responses to particular medical interventions. And in addition, we can't forget the low-tech interventions. For example, many of us in medical school learn suturing just using simple things like pig skins or chicken skin in order to kind of practice suturing. So this was also a form of simulation. The advantages of simulation are many. It avoids situations where training can be a detriment to the patient. Certainly, if one can practice prior to working on a live patient, it can provide a great deal of safety. It alleviates performance anxiety of the learner. The learner can practice a clinical skill at their own pace. And in simulated settings, errors can be allowed to progress and allow the student to understand the consequence of their error. When caring for live patients, certainly the attending physician or the educator must step in quickly if it appears that the student may be making an important error. Also, video feedback increases the impact of the educational experience of the student, especially with standardized patients. It allows the student a chance to reflect, metacognate, and identify patterns in their care of patients. The challenges of simulation, is that feedback needs to occur in a timely manner if one is using video recording. Training of faculty is necessary for consistency in feedback, and it can be expensive. One of the challenges in medical education today is to find ways to efficiently use the kind of high-tech simulation devices. Our goal would be to have these devices being used on a very regular basis in order to cut down on the costs. And also, one of the challenges is the reliance on technology. The technology, as all of us know, can sometimes throw in problems in terms of education, and we need reliable systems to provide that. Now, in regard to a specific example of simulation, we decided to talk about the role of virtual microscopy in medical education. And what this means is that instead of using a handheld microscope, students can learn histology or histopathology by using computer screens in order to look at individual slides. The advantage of this is it allows students to use a computer or tablet to view microscopic images. It allows for independent learning, and it also increases the number of samples available that the student can examine. Rather than carrying around hundreds of slides to look in our microscope, you can actually access a large database of images. It is certainly a familiar technology to millennial students. There are, however, some disadvantages to virtual microscopy. One loses a sense of perspective and the true size of what you're looking at. Students can sometimes go off course in the sense that they may think they are just, looking at a particular tissue or cell type and lose the kind of focus of what the education exercise is attempting to get across. It does require technical support, and although not necessarily a specific disadvantage, it is important to note that this type of training requires extensive preparation time. One of the examples from our team was the fact that when a teacher is present, he can certainly kind of be much more flexible and bring up points while the students are in a lab looking at the microscope, whereas if you're creating a virtual microscopy course, one must actually work that in to the materials so that you're certain that the students will get the key points that you want to get across. The educational benefits of virtual microscopy certainly provides a fluidity of expertise. Students can work in groups and vary their role of expert and novice by studying components and then teaching it to their peers. It also allows for students to take on supportive and critical roles to increase collaborative learning. The other area is patterning. Greater sample size allows students to learn patterns associated with basic tissue types and apply them in more complex systems. In addition, one can examine normal and pathological tissues side by side, allowing students to see disruptions in patterns and to evaluate the consequences. The rationale from virtual microscopy is as follows. Virtual microscopy facilitates student work outside scheduled laboratory time, which promotes self-learning and problem solving while decreasing faculty-student contact hours. The LCME recommends in the 80s and 90s decompression of medical school curriculum and reduction in student-faculty contact hours. Also an emphasis on self-learning and problem solving. It also provides more efficient use of resources, both time and financial resources. By decreasing faculty staff at many centers with a resultant increase in workload for individual faculty, however, less faculty are needed to run labs but more preparation for exercise with fewer faculty. Microscopes, slide sets, photographic slides are expensive to maintain and store and much easier to provide in an online situation, and decreased suppliers of microscopes for rent. In addition, we teach only what physicians really need to know. Most physicians in their clinical practice don't need to know how to view specific histology slides, and so one can focus really on what the students need to in their professional careers. The place in the curriculum. Virtual microscopy is used principally in the basic sciences when teaching basic histology and histopathology. It can also be used to teach neuroanatomy, neurohistology, as well as pathology. One of the questions that was brought up is, do students still need to learn how to use a microscope? And this caused some anxiety, especially with Dr. Behling, because of how important she feels it is for students. But most physicians do not use microscopes to view histology in a clinical practice. However, it is common for physicians to use microscopes to view gram stains, urine sediments, blood smears, and wet mounts. And so even though we have virtual microscopy, certainly the microscope has not lost its role. In summary, simulations can be a great tool in the medical school curriculum, allowing for formative feedback and the ability to learn skills in a relatively consequence-free environment. As technology advances, we expect simulation to become a much larger part of the medical school and residency curriculum. Despite its growth, however, great care must be taken to ensure proper utilization of simulation within a curriculum.